Hi there, I'm Anna and you're listening to 1kWith, Kaleidoscope's latest venture, a series of 1,000-second conversations with a range of interesting people across health and care. Kaleidoscope is a social enterprise and we have set up to bring people together to improve health and care, and a lot of our work focuses on having interesting conversations and talking about topics which we think are important. And this has led us to 1kWith, and we're delighted to be joined by Andy Cowper today, who is editor of Health Policy Insights and contributing editor to the HSJ. And to fill our 1,000-second opportunity to hear from Andy, we've asked him to think of 3 defining moments throughout his life which have brought him to where he is today. And we'll also be asking a number of surprise questions which are here in the bowl in front of me, but more on those later. So over to you, Andy, for your first defining moment, if that's all right.
Thank you, Anna. I thought, with your permission, I'm going to talk about people rather than moments, because I started writing about the politics and management of the NHS 20 years ago, not knowing anything more about it really than the average informed layman who maybe read the politics columns in newspapers, which meant that I had to listen to people who knew quite a lot. And one of the first people who I did talk to quite a lot at that time was the late Professor Alan Maynard, who's a very famous health economist from the University of York, and also a very powerful communicator. I got to know him first because he was writing a column for the magazine that I edited. And Alan was, as well as being a reliable columnist and funny and able to communicate the issues of health economics and how they interrelated with policy and the wider system, he was a guy who had skin in the game. He was chair of the York Hospital Trust, and so he was not just pontificating about using health economics and data more fully in healthcare. He was actually taking a role in the system and trying to make sure that it happened. And Alan was a great influence in many ways and a very good friend. One of the memorable times I remember talking with him was at a conference of fellows of the Health Foundation, and they still do, I think, a fellowship program. And Alan and myself were asked by another friend to talk at a conference, and I talked about communications, and Alan talked about health economics and data and putting it into practice. And there were these fellows, they were quite experienced clinicians. These were people in the second decade of their career by and large. And Alan, he has quite a confrontational style of presenting, particularly to clinicians. And he got some very good challenge back, which he enjoyed. And so, the debate was robust, which was great. And in the evening, we went and had dinner, and a couple of people picked up the conversation with him. And somebody said, how is it really going? Because you're chairing a hospital. And he goes much more slowly than I'd have liked. But he said, I got a bit of heart recently because I've been making all the clinicians, all the surgeons, look at their data, and they didn't like it very much at first. They all quibbled about the accuracy. But he said, but gradually over time they've accepted that I'm going to keep on pushing it. So now they look at it. And we were in a meeting, and one guy was looking at the figures, and he said to one of his colleagues, right, look at this. You're having a rest. And this person replied, let me have a look at that. And a piece of paper, and he goes, all right, I'll sort it. And Alan's takeaway from that was, I finally thought we might be getting somewhere. And he was an interesting figure in a lot of ways. He was one of the strong proponents of what became GP fund holding in the 1980s. And what I found very fascinating, because I continued to publish his columns on Health Policy Insight for as long as he was able to write them. And towards the end of his last few years of life, I think he really came to the conclusion that it hadn't worked at all.
Oh, really?
And he said, the purchase of proprietor split in healthcare was just not delivering anything. And if it's been tried and if it's been worked, let's not do it anymore, because there isn't the money to sustain it, even if it worked, and it doesn't seem to work. We don't seem to be able to make it work. And that was impressive to me, that he was able to change his mind so publicly. about a policy which he'd advocated.
Yeah, that's quite impressive. I mean, do you think there is any kind of wriggle room in the health and care sector to do that? I feel like often in the NHS and otherwise, you introduce a transformation programme and of course it has to work, and there's not really that ability to backtrack or change your mind.
I mean, I've come to the view that one of the problems that the system has is that, you know, originally there was a box in the centre marked Whitehall, and it was where you know, the famous dropped bedpan in Tredegar had to reverberate around the office of the minister in Whitehall, I think. Yeah, and I remember is alleged to have said something like that. And whether you slightly decentralise that box by moving it to Skipton House and Elephant and Castle or wherever it is,
branching out.
but I'm not sure you've got away from the problem that you have to deliver the correct answer and that you have to deliver success. So on the one hand, you're saying we want more innovation and creativity. On the other hand, we want success. And you know, there's just a tension there that isn't discussed, which is unfortunate. And one of the things that I was very impressive to me about the way in which Alan communicated was he was a bit of an agent provocateur. You know, he kind of liked to throw bricks and he liked to cause a bit of a row and sometimes sort of overstate his case for dramatic effect. But you know, he believed in communicating robustly and talking about the world as it is. And a big problem, a huge problem within the NHS, the care sector I know a lot less well, but I think a massive problem within the NHS is people don't communicate very candidly and they tell it like it isn't. And my belief is that that's a bad idea. So yeah, I think that was a person who influenced me very strongly.
Brilliant, thank you for sharing about Alan. Sounds like an interesting guy. I'm conscious of time, so we'll move on to a surprise question, if that's all right. So could you please pick one out of the box?
I will. Here we go. Let's have a surprise.
Thank you very much. Okay. So the first question is, what's the NHS's biggest failure? So starting off on a positive note with the surprise questions there. Sorry about that.
The NHS's biggest failure. I have this theory which I keep banging on about, which is that I think the NHS needs a chief anthropologist a lot more than it needs any chief inspector.
Why so?
We've gone down the route of very, very heavy regulation in an attempt to solve quality problems, and I think probably particularly in a delayed, stable door shutting exercise after the mid-staffs scandal in particular. And I don't think it's worked because the crisis in the NHS is to a certain extent a funding crisis, but to a very large extent it's a workforce crisis. And in the circumstances where funding is very tight, albeit less tight than it is for a lot of the rest of the public sector, and you just have not got enough clinicians. I think that manic attempts to over-regulate things are unlikely to provide enlightened solutions. So what I think the NHS has got wrong is something about candour and openness, as I said, and something about culture. And it's not just the culture within the community of chief executives or, you know, very senior managers. There are real problems in medical culture. You know, there is intense tribalism among the various clinical professions. We've gone down the route of hyper-specialisation in particular, and actually probably if you look at the burden of disease the NHS is facing, we need more generalists, geriatricians.
Yeah, that's often talked about, isn't it? Do you think there's more tribalism though in the NHS than other public sectors or other kind of parts of?
I think that's a fabulous question. I haven't spent 20 years writing about any of the others, so I don't have a remotely informed answer that I could offer. Is there a vast divide between history teachers and maths teachers and dance teachers? I don't know. You know, medicine and healthcare are complex, but I mean, teaching's complex too. These are all human contact sports, aren't they? I think, you know, I don't necessarily have a solution because I'm a journalist rather than
here today, Andy. We just want solutions.
But I certainly feel if people understood how tribal a lot of the behaviour is, perhaps they'd be embarrassed by it. I was struck by something that I read in the last couple of months, and somebody was talking about they had been in a situation in their office where they'd been a bring your children to work day.
Oh, right.
And they noticed how much better it made behaviour in meetings.
Really? That's so interesting.
Because there were children there.
Yeah.
And people who might behave obnoxiously or irritatingly or
just a bit more thoughtful about having.
Yeah, so I kind of just thought, a child for every boardroom. I don't know if that's feasible, but it was just an interesting moment where you sort of go, actually, something happened there that changed the culture, albeit temporarily. I think culture is really important and under discussed.
Absolutely. I would like to discuss it further, but we are going to move on to your second defining moment, if that's okay.
Yeah, another defining person. Talk about Dame Julie Moore, who recently retired as the chief executive of the University Hospitals in Birmingham, is now a non-executive director at Worcester, where Sir David Nicholson, former NHS chief executive, is chair. And I met Julie first. I knew of her, formidable reputation ahead of time, but I met her first in the context of some work I was doing for the Health Service Journal. We did a commission on hospital care for frail older people, and it was sponsored by Serco.
Okay. And
Serco had a fairly high-profile problem with NHS contracts in sort of the 18-month period, I think, prior to this event happening. So there was a level of, and the commission had some, quite high profile names on it, and one or two of whom were kind of, we're not too sure about all of this. And so I was going along to the first meeting. Julie agreed to chair it, and that was great because we needed a big figure who knew what they were talking about as a chair. Because there was a senior geriatrician, there was Professor John Appleby, then of the King's Fund, now Nuffield Trust,
needed
sort of economics advisor. You absolutely, some big personalities from all of the sort of the social care sector and geriatric nursing. Julie had a reputation as being very formidable and was deserved, but when we sort of got to talking, she just didn't like being bullshitted.
Okay.
And I'm not. Well, I mean, there may be a diversity of views on this, but I'm not. The story I tell myself is that I'm not a massive bullshitter.
Okay.
So we just were able to talk very openly about the reputational challenges around the sponsor, and the guy who then was Serco, John Neuer, who's did us all great favours, because John's a very bright, very intelligent, very articulate guy, and was incredibly sincere about wanting this to be a good piece of work, and it was going to find what it would find. Health Service Journal, which I'm very proud to be associated with as contributing editor, and I write a weekly column for them. Good at, as it were, not buying a sponsor's line, hook, line, and sinker. HSJ's got a good brand, and it's not for sale editorially, but we're very happy to work with John in particular, and he came to the project with very good thoughts and observations of his own, but with a lot of humility about the way in which Serco was then regarded in the NHS, and people had their sort of concerns, and Julie chaired the meeting with incomparably well. Everybody was heard, everybody felt they'd been listened to, and within an hour and a half of what started out as quite a tough meeting, we were at work. We were going, okay, this kind of scope of this project will be like that, and that was down to her. That was entirely down to her skills as a chair, her skills with people, and that was probably one of the pieces of work I'm actually most proud of that we did. It was a real pleasure to work with those commissioners and with Julie, and just to kind of to get to know somebody who had this huge and formidable and well-deserved reputation, but to kind of see that essentially, if you don't try bullshitting her and lazy thinking, and there were a few times when I just said things which I heard and believed to be true, and they were wrong, and Julie was just like, boom, straight down my throat, and correcting me in no uncertain terms, and that's great. I love people like that, but again, the NHS seems to find people like that very marmite-y.
Okay, yeah.
You love them or you hate them, and I don't know to what extent the fact that Julie was a woman, the fact she was an out gay woman, may have contributed to that reputation. But yeah, absolutely great person with a formidable career, and I felt very, very fortunate to have worked with her and all the people who were involved in that project.
Yeah. I mean, she sounds incredibly impressive, and that project went on to achieve the things it wanted to achieve.
We were kind of saying, ultimately, we concluded that, you remember that there was a lot of emphasis at the time on putting more care out of hospital, and it would reduce pressure on hospitals and save costs in hospital. And we looked at the available evidence, and the available evidence told us that there's no sign of that actually happening. That what did happen, hopefully if you got it right, was you'd improve the quality of care for frail older people, and you might therefore achieve less long stays in hospital, and that stays in hospital aren't great, particularly if you're off your feet, loss of muscle and wasting of your ability to be independent happens very, very shockingly quickly, and obviously there's a massive problem because the number of the oldest old is increasing very, very significantly, and that's part of the current challenge. But yeah, I believe that we were the first people to very, very publicly say, you're not going to save money with this. This is not going to reduce the pressure on hospitals. You might delay it a bit. You may well improve the quality of care. It's worth doing for those reasons. And I think that got up a few people's noses. Good. Yeah. Good.
Brilliant. Thank you. Let's move on to your surprise question number 2, please. Okay. Thank you very much. Question 2 is, what are you interested in that most people aren't? A tricky one.
That is a good one. That most people aren't interested.
The whole world population.
Yeah. Half the population of the world plus one. What am I interested in that most people aren't interested in? Ingmar Bergman's films are quite niche, aren't they?
Okay.
I like Ingmar Bergman's films. They're niche.
What do you like about them?
I like the fact. So I think I got into them as a sort of intense teenager in my. I almost certainly wore a black polo neck jumper a lot at the time.
Still very stylish.
Yeah. I don't know. Did you ever see that piece of YouTube footage of Tom Cruise talking about Scientology?
No, try to avoid all Tom Cruise.
So there is this bit of footage. I don't know whether it's still on the internet, whether it's been taken out, but it's definitely him, and he's wearing this black polo neck, and he's just sort of behaving in this. And I remember watching it and thinking, I'm never going to wear a black polo neck jumper again. And I haven't. So just consistency.
Words to live by.
What's great about them? I mean, some of them are just beautiful. Funny, charming stuff like Smiles of a Summer Night of his early films. And I was watching a documentary film about him recently, and it made me realise that he made The Seventh Seal, very famous allegory about death in the 14th century, a knight who's returning from the Crusades, very famous photograph of them playing chess at the start of the film. And that's a very dark, kind of quite bleak Bergman. Yeah. And in the same year, he made Wild Strawberries, which is this sort of story about a quite emotionally damaged old man who's on his way to receive he's a doctor, on his way to receive an honorary degree, and it's explores the relationships with his family. And it's kind of it's a tough film. It's quite harsh on this main character, but it's also redemptive. There's some sort of beauty and forgiveness in there. And I discovered from this documentary he made them both the same year, as well as directing a television play and doing a huge production of Peer Gynt at the Swedish National Theatre. So that was that was a man who was on fire. If you ever want to feel like you're a bit of an underachiever, you kind of go, okay, he made the 3 films and a huge play that in 12 months.
Very different frames of mind, I would imagine, needed for all those variety of
I think so.
Brilliant, thank you. Let's move on to your third defining person.
Third defining person. Who am I going to pick?
Or it could be a moment if you change your mind.
No, I think I'm going to stick with people because people are who I learn from.
Yeah.
A lot of what I do, which involves doing research, keyboard, reading stuff on screens, and whatever. And obviously sometimes I'm going out and talking to people and interviewing them, etc., etc. But a lot of what I do is essentially a producing copy factory. And so I get what I know from people. So yeah, I'm ashamedly going to go for another person. And I think I'm probably going to pick Professor Aidan Halligan, who is also two of my 3 influential people are sadly no longer with us, and Aidan died a few years ago. But Aidan was the Deputy Chief Medical Officer under Sir Liam Donaldson in the time of the Blair government, and we got to know one another a little, I think, on the conference circuit. And Aidan was just a delightful guy, full of charm, full of warmth, and he was. We were talking about various things, and a situation came up where I became aware, mainly thanks to another of my heroes, Nicholas Timmins, author of the 5 Giants, peerless work about the biography of the welfare state, and also former Financial Times public policy editor, and now writes these fabulous books for the King's Fund, Nuffield Trust, and Health Foundation. Never Again, on the Lansley reforms and glaziers and window breakers, and the types of health secretary. And Nick was writing a column for this magazine, which I published, and Nick kind of led me to the point of understanding that the guy who was then the chief executive of the NHS, Sir Nigel Crisp, now Lord Crisp, was this was 2006, and basically the NHS had been seeing 6% real terms cash growth year on year for many years by that point, but was still in a situation of looking like it was on course to overspend by £1 billion. Wow. And the relationships, I think, at the top of the system were not great, and so I effectively, via Nick and via another friend, really became aware that Lord Crisp was kind of not going to be in the job for very long, and basically I wrote this editorial and front cover of this magazine. It was a bunch of questions, why is the new tariff being withdrawn X years out from the next year? How has the purchaser parity agreement been changed without reference to trust, etc., etc.? And it's time to go, Sir Nigel, was kind of the payoff line. And I put that off to the printers and went home to bed and didn't really sleep very much, because it's one of those big calls where you're going to have to go if you're wrong. But sort of the following morning, I got a call from my contact, who was kind of very close to the action. He said, Nigel's just walking across Whitehall to go and see Tony Blair, and indeed, whatever happened during that conversation, Lord Crisp decided that his talents would be more appropriately deployed elsewhere. Wow. So that was kind of a big moment, I suppose, insofar as I've had one. But after that, I asked a bunch of people to write short pieces for how should the NHS go now in a post what. And Aidan wrote this piece, and it was just stunning. I mean, when I read it, I couldn't quite believe.
Oh, really?
Yeah, he said, any suggestion? We have learned that doing more of what we have always done will just give us more of what we have always had. And he was talking about, while the introduction of targets was courageous and appropriate, they've now progressed to the point where they're a burden more than a help. And more broadly, he was talking about clinical leadership. And he said, any suggestion of real reform is a deceit. Working patterns, practices, and customs are at the heart of many capacity issues and have never been challenged. And it was whew, he wants me to publish. I'm going to publish it. So I did. And Nick, I was talking to Nick about his next column. I said, "Oh, you'll want to see what Aidan has had to say." And so it went from the British Journal of Healthcare Management, which I was then editing, which was well read by the people who read the British Journal of Healthcare Management. But obviously Nick was still the public policy editor of the FT, and he picked this out, and it was a page lead in the Financial Times, and then was picked up by a young politician and then leader of the opposition called David Cameron, used to beat Tony Blair up at Prime Minister's Questions one week.
That's an impressive reach.
And Aidan was forced to fall on his sword in fairly short order, which he did, I think, quite happily.
Okay.
He was Deputy Chief Medical Officer, and he just went off, and he then did a number of really interesting things. He set up a training program for clinicians to see how teams functioned, and they built a set. They got an industrial unit, and they built a set that was like a replica of part of a hospital, and they took people there to be trained under pressure.
Wow.
Which I thought was very clever. And they didn't find a business model that worked for that, I think. But what an impressive innovation. I think Aidan put his own money into that. And then later he was very involved with Pathway Healthcare, which was a co-production with UCLH, where he was working and designed to improve healthcare for homeless people. Wow. And he was one of the great guys, because that sort of thing I say about people not telling the truth, well, he really did. And cast away a job for which many people would kind of give their right on. But it was more important to him to just be honest about the situation as he saw it. And that's a most impressive guy.
Sounds like a very impressive kind of quality or trait to possess and be able to go forward with in your working life, certainly. Let's move on to your third surprise question, please. If you wouldn't mind picking one out of the bowl.
There we go.
Thank you very much. What do we not talk about in health and care that we really should? We may have touched on this earlier. But,
yes. I think culture and candour. I don't believe we wait sufficient. We know from the research of Professor Michael West about well-functioning teams being associated with better clinical outcomes. So that's a huge point about working culture, right there. And candour. I still get too much of a sense across the system at system leading bodies and big organisations that we can just comms any problems. We can crisis comms that. And you can't now. You can get away with that for a very short period of time if you've got someone very, very skilled. I know some very skilled comms people, but it's not where it's at.
Why do you think you can't now? Is that because of the, more transparency, or
because it's easier to more data is in general being published, although some of the advances which we've seen around publication of PROMS data, that's going somewhat backwards, which is concerning. But it feels as if we are on a trajectory towards more publication of information, more openness. It doesn't feel as if that one's going to go away. And I think there's probably a pretty strong safety argument that it shouldn't. And I have thought for a long time that the NHS should maybe try and be a bit more like the Pompidou Centre, and put all the workings on the outside. And have there's a very impressive thing which a friend of mine, Andrew Foster, who's stepping down soon, but still at the time of speaking, the chief executive of Brightington, Wigan and Lee. And Andrew is the former director of workforce for the Department of Health in the CRISP era and before. And Andrew tweets once a month at the start of the month. He tweets about how many never events they've had, how many MRSAs, how many C. diffs, how many wrong site surgeries. That's really good. So I mean, obviously he's often on there praising staff and talking about the great achievements of their organisation, but he's also going, we are still not there. We're not perfect yet. We're not we're not as safe as we perhaps could be. As no organisation is, because human beings make errors. And of course, what else does the NHS not talk about? Well, what are the real causes of errors? I still think we're pretty weak at a system-wide level, across the system level, of going, what are the likely factors that are going to lead to unsafe care? And another thing which I think would sit well alongside the chief anthropologist would be a chief of human factors for the NHS.
Interesting. So a couple of new roles that we should be introducing there. Andy, I think that's all we have time for today. Thank you.
Sorry if I've shot your time back to shreds.
Not at all. It's fine. Thank you for joining us and sharing those kind of 3 defining people and more people, actually. I think we talked about quite a few different characters. Thank you all for joining. If you want to catch up on the rest of the 1kWith series, please visit kaleidoscope.healthcare or join the conversation on Twitter, #1kWith @kscopehealth. Thanks everyone. Bye bye.